I think the simplest thing, the leadership of a hospital, from the board of directors to the CEO, can do to dramatically change the safety of patients at a hospital is to tie zero preventable death goal to the bonuses of the faculty and the executives.
So I think my biggest piece of advice is teach your clinicians how to admit when something happens, whether it causes an overt error that causes real harm or even minor harm. And the more that becomes inculcated in the culture, the more the clinical and non-clinical staff of the hospital will be engaged in a campaign to make the place safer.
I think the most important thing is to actually jump into the local work of patient safety in your organization. Don't delegate it. Go to your event reviews, understand what is happening, role model positive behavior of just culture and allowing employees to feel safe. By you going first, they will follow.
There needs to be a process set in place so that when a family member or a patient, when you realize that you're in trouble, that there's an actual system set in place to seek help. I've seen so many cases, in my own family situation, where you realize you're in trouble and you don't know what to do. You have nowhere to go and you can't get a doctor.
I would use an analogy to a doctor. I would say to the doctor, you need to make this patient's safety your number one priority. The CEO equivalent of that is to say, we will have zero preventable errors in this hospital. And if he believes that and buys into that, he will make it happen.